What is a PVR and how will it help you? The PVR, or post-void residual urine volume, is the amount of urine remaining in your bladder after you urinate. There are three primary ways we check it. First, this is the bladder scanner. It measures the amount of urine in the bladder using basic, non-invasive, typically pain-free ultrasound. It involves gel on the lower abdomen above the pubic bone where the bladder is. So if this area of your body hurts when pressed on, tell the staff member beforehand. The sensor vibrates as the ultrasound picks up how much is in the bladder. The scanner here will tell us that there's currently 448 milliliters in the bladder. This is about 15 ounces. If someone has this much in the bladder after urinating, they have an elevated post-void residual. If they haven't yet voided, this would be considered a random residual and relatively normal, as the bladder typically holds 300 to 500 milliliters or 10 to 17 ounces. It should be relatively empty after voiding, under 30 to 150 milliliters or 1 to 5 ounces. If that's a little difficult to remember, a good rule of thumb is that we should empty approximately 2/3 of the bladder when we go, ideally 7/8 of the bladder when we urinate. Second, a more accurate way to get a PVR is by catheterizing after voiding. Straight catheterization is helpful when you need to get an accurate urine culture or when the body habitus or incisions on the lower belly make it difficult to use the bladder scanner. Catheterizing the urethra ranges in discomfort, but for most people it's a tolerable nuisance. If it hurts, definitely tell the staff. Third, there is a calculated post-void residual, and this is typically used when somebody already has a catheter in place. Either they experienced urinary retention where they were unable to void, or they needed the catheter for medical reasons, such as during an intensive care unit stay, or they had urologic surgery, for example, a sling or a prostate surgery. When the catheter is removed, we want to make sure the person is emptying the bladder appropriately. So first we gently instill fluid via the existing catheter, noting the amount. Then we remove the catheter when the person says they feel full. It's called a voiding trial. When they empty that fluid, we measure the amount they go. Now we can subtract the amount voided from the amount instilled, which gives us the post-void residual volume, the amount still left inside. So why is the PVR, or post-void residual volume, important? Well, if the bladder is fully empty, we're going to have less frequent urination because we empty all the way when we go, less urinary incontinence or leakage, fewer urinary tract infections because we evacuate any bacteria, and a healthier situation for the kidneys as they try to empty in the bladder downstream. I hope this is helpful. Please subscribe and take a look at our other videos. Thank you.